Hello, it's Dr. Gary Burton coming to you from beautiful sunny Florida, and today we're going to talk about breast reduction surgery or reduction mammoplasty. This operation is done under general anesthesia. It usually takes in between 2 to 4 hours to do, depending on the size and shape of the breast. And following the operation, the patient will spend usually about another hour with us in a recovery room prior to going home. Most patients go back to work in a week's time and can resume full regular activity in 4 to 6 weeks. Breast reduction is done for women with large breasts who want smaller breasts. This can be a cosmetic reason or it can be a medical reason. A cosmetic reason is that you have large breasts and you simply want a smaller breast. Medical reason, you have a large breast and it's interfering with your lifestyle. You have chronic back pain, neck pain, shoulder pain, you have grooving in your shoulders from your bra, or you have a rash underneath your breast. There are many ways to do a breast reduction procedure. In my practice, I usually do it 1 of 3 ways. Or the patient's going to have either 1, 2, or 3 scars following the operation. One scar is going to be around the nipple areolar complex. The second scar is a vertical scar from the areola to the base of the breast. And the third scar is a scar that runs along the base of the breast. What's going to determine how many scars you have is how large your breast is to begin with and how small you want it to be after the operation. If you have a very large breast to begin with and you want a large or moderate reduction, you probably are going to end up with 3 scars over the breast mound. A circumferential scar around the areola, a vertical scar over the lower pole of the breast, and a transverse scar along the base of the breast. Most women with large breasts or macromastia also have some degree of breast ptosis. Breast ptosis is a droop of the breast itself. With the breast reduction, we're going to remove unwanted breast tissue, and we're also going to lift the nipple areolar complex during the course of the operation. So this is going to give you a smaller breast and a more youthful appearing breast when everything's done. So we worry about tissue loss. This can be anywhere on the breast mound, including the nipple areolar complex. We worry about decreased sensation in the nipple, and we also worry about the inability to breastfeed following the completion of the operation. These risks and other risks will be discussed in full during your initial consultation. So what to expect the day of surgery? You'll come in, we'll go over your medical history again. We will have you stand up, we'll take preoperative pictures, and then we're going to mark you. We're going to plan our incisions that we're going to make on you during the course of the operation. Following this, you'll be escorted to the operating room. You'll undergo general anesthesia. The operation will be carried out, and depending on the size of your breast, the shape of your breast, this operation is going to take anywhere from 2 to 4 hours. Following the operation, you'll spend another hour with us in recovery, and then you're going to go home. When we send you home, we're going to send you home with 3 medications, something for pain, something for nausea and vomiting, and an antibiotic. Of the 3 medications, the only one I ask you to take is the antibiotic. The pain medication is optional. You can take it, you can take Tylenol, Motrin, or nothing at all, depending on your pain threshold level. And the nausea and vomiting medication also is optional. But do take your antibiotics for several days following the operation. During the operation, I'm going to place you in a postoperative breast binder or an elastic bandage to apply general compression over the chest wall and breast. You're going to stay in this for a couple of days. Following this, we're going to place you into a sports bra to continue to apply some gentle compression, and you're going to stay in the sports bra for about 4 to 6 weeks, and then you can go back into the regular bra. And I ask everybody to give it a good 2 months before going out purchasing an expensive bra, because during this time period, the inflammation is going to settle and your breast size and shape is going to slightly change.